Bismillahirrahmanirrahim. Let's discuss the last topic of chapter 3, pathology, that is shock. The clinical state of cardiovascular collapse characterized by acute reduction of effective circulatory blood volume and hypoperfusion of cells and tissue is called shock. Circulatory system can no longer supply nutrients and oxygen to the peripheral tissue, and shock means to shake or jerk. That's all. Type of shock. There are 5 types. First one is hypovolemic shock. It occurs due to blood loss, plasma loss. Clinical examples include hemorrhages, fluid loss, vomiting, diarrhea, etc. Second type is septic shock. It may occur due to gram-negative bacterial infections or gram-positive bacterial infections. Gram-negative bacterial infections, for example, due to Salmonella, Shigella, Pseudomonas, and it involves endotoxic shock. And gram-positive septicemia, for example, due to streptococci, diphtheria, pneumococci, it involves exotoxic shock. Examples include microbial infections, endotoxic shock, gram-positive septicemia, etc. Cardiogenic shock. Cardiogenic shock occurs due to intrinsic pump failure, extrinsic compression, or outflow obstruction. Intrinsic myocardial pump failure include myocardial infarction, rupture of heart, myocarditis, cardiac arrhythmia. Extrinsic compression include cardiac tamponade, and outflow obstruction include pulmonary embolism, arterial myxoma. Let's discuss anaphylactic shock, the fourth type. It is initiated by allergy, that is generalized by Ig-mediated hypersensitivity response. As a result of this, systemic vasodilation occurs and vascular permeability increases. Neurogenic shock, it occurs due to a static accident, for example, anesthetic accident, for example, in spinal cord injury. There is loss of vascular tone and peripheral pooling of blood. As a result of that, there would be effective circulatory blood volume decrease that would eventually lead to decreased cardiac output, hypotension, tissue hypoperfusion, and as a result of this, there would be cellular anoxia. Let's discuss the pathogenesis. For example, there is loss of fluid or blood. As we know, this is hypovolemic shock. That will lead to decreased venous return and decreased cardiac output, that is cardiogenic shock. Now that will lead to failure of oxygen perfusion, that is called shock, and as a result there will be multiple organ dysfunction syndrome and death. This was the pathogens of hypovolemic shock and cardiogenic shock. Let's discuss septic shock. In septic shock there is a gram-negative bacteria that releases lipoprotein lipase. Lipopolysaccharide. Now when they secrete lipopolysaccharide, what happens? The formation of lipopolysaccharide binding protein complex occur. That complex bind to toll-like receptors. As a result of this, endothelial cell activation occur and macrophage activation. This was the bacterial degradation by inflammatory cells. Septic shock also lead to cytokines effect like inflammation, initially localized, later systemic, and fever. Systemic vasodilation is also seen that will lead to decreased cardiac output, hypotension, decreased heart contractility, and multi-organ failure. It will also lead to activation of coagulation, thrombosis, and disseminated intravascular coagulation. Let's discuss the stages of shock. Non-progressive, progressive, and irreversible. In non-progressive, reflex compensatory mechanisms are activated that maintain the perfusion of vital organs. In progressive stage, tissue hypoperfusion occur, lead to worsening of circulatory and metabolic imbalances. Lactic acidosis occur that will decrease the cardiac output. As a result, there will be widespread tissue hypoxia. In irreversible stage, there is widespread cell injury leading to lysosomal enzyme leakage with persistent vasoconstriction, myocardial dysfunction, cerebral ischemia, renal ischemia, and death. Morphological changes can be divided into gross and micro in different organs. For example, in brain, it will be swollen, gyri widen, sulci narrowed, and poor demarcation between the white and gray matter. While in micro, you will see the red neurons, and karyorrhexis and cytoplasm will be eosinophilic. Pyramidal cells, Purkinje cell, astrocyte, oligodendrocyte all will be affected. In heart, there will be focal and widespread coagulation necrosis. Along with that, you will see the subendocardial and subpericardial hemorrhages. In kidney, once kidney is in shock state, it is soft and swollen. There is poor demarcation between the cortex and medulla, and in micro there appears acute tubular necrosis. In lung, gross, heavy, firm, fat, and red, and the cut surface bulges and oozes blood. Adrenal gland hemorrhage, and in hemorrhagic gastroenteropathy, you will see the curling ulcer, that is acute stress ulcer of stomach or duodenum in shock. Liver fatty chains, central hemorrhagic necrosis is seen. Let's discuss clinical features. Hypotension, tachycardia, cold clammy cyanotic skin, drowsiness, confusion, irritability, death. In shock management, position, clothing, vital organs important, airway should be maintained, stimulant should be given, and treat the cause first. There are a few general terms I would like to explain you. First one is systemic inflammatory response syndrome. That occurs when 2 or greater than 2 of the following conditions are present. For example, temperature greater than 38, heart rate greater than 90 beats per minute, respiratory rate greater than 20 beats per minute, and WBC is greater than 12,000 cells per minute. Sepsis occur when systemic inflammatory response syndrome plus infectious disease occur. Severe sepsis means sepsis plus hypotension. Septic shocks means sepsis with hypotension despite fluid resuscitation plus hypoperfusion abnormalities. And multiple organ dysfunction syndrome include organ failure due to severe infection or non-infectious insults. That's all.